Hello, dear students. I am Dr. Nikita Valluri, working as an assistant professor in Siddhartha Institute of Pharmacy. Today I'm going to start with our new topic, that is biological effects of radiation. In that topic also we have studied regarding the radiation carcinogenesis. So it is also linked a bit to that. And coming to going to this topic. So, what is biological effects of radiation? So, coming to the definition of that, so the harmful effects caused to any human beings or any other living beings due to the effect of radiation is called as biological effect of radiation. So, because of the radiation, if these radiations cause any harmful effects in human beings or any other living beings, then that effects which were called as biological effects of radiation. Okay, so then radiation effects on cells. Basically, there are three things that can happen in the cellular level. First is the radiation may pass through the cell without doing any damage to the cell. So these radiations they will enter into the cell. That means the person who got exposed to that radiations, it will penetrate to the cells of that person, but it does not cause any harm to the or damage the cells. Second is the radiation may damage the cells, so it will damage the cell so that the cell do not form to repair itself. So in our body, it has ability to fight against anything, right? So even after when these cells were got exposed to these radiations, our cells were unable to repair damage caused because of this exposure to radiation. So then when so even usually cells undergo reproduction, right? So when they reproduce, in that reproduced products also this damaged thing will be transferred. That we call it as biological response. Okay. So when the cells got exposed to these radiation, these cells got damaged, and whatever the damaged cells are there, if they are unable to repair the damage, and the same damaged things will transfer to the next generation by reproducing, then that response is called as biological response. And the radiation may cause so much damage that the cell dies. Third is it causes severe damage so that the cell dies there only. When coming to the second step, it causes certain damage, and this damage cannot be repaired, and the damage will be transferred to the next cells. When coming to third, it causes certain damage, serious damage that the cell dies. So these are the three things that can happen in the cells. First is it does not cause any damage to the cells. Second is it causes damage to the cells, and our body will not be able to repair, and the same damage will be continued. Third is because of the severe damage, the cell dies. So these are the three things that can take in the cellular level. And then, so out of all the radiations, so the most important is nothing but the radiation which cause much damage to the human beings or any living organisms is the most of the damage is caused due to ionizing radiations. So how does it affect these cells? So mainly the effect on cells was caused by ionizing radiations was studied under three headings. First is somatic effects, second is genetic damage, third is malignant transformation. So what is somatic effect? So which cause acute cell killing? That means immediately when particular cells gets exposed to these ionizing radiations, it cause somatic effect. Somatic effect is nothing but these radiations directly kill the cells that were got exposed. That is somatic effect, and that is radiation effect occurs on an exposed individual during his lifetime. So that is called as somatic effect. So it may induce cancer, but it doesn't cause the cancer. So it will just initiate the cancer. So these were the risk of radiation exposure, and this can be seen in the individuals who are continuously exposed to radiation. So like the ones who are working in radiology department. And then second is genetic damage. So genetic damage takes place by mutations. As genetic damage takes place, whatever the new cells were formed, the same things will be transferred to the next generation of cells, and that will be transferred to the next progeny of cells. The radiation induced mutations affect the health of offspring. So because of these mutations, not only that in that cell which got exposed, but also the offsprings of that cell also gets this damage. And genetic damage cannot be repaired. And coming to malignant transformation of cells, so cancer risk is more seen in children who are exposed to radiations compared to adults. So the risk of getting this malignant transformation is more in children compared to adults, and it may induce both benign and malignant tumors. So this thing we have discussed in the cancer topic, that is uh, radiation carcinogenesis. In radiation carcinogenesis, we have seen how malignant transformation of cells takes place. And the other thing is fetal risk. So, if the pregnant ladies, if they were exposed to any radiations when they get exposed to certain X-rays or any if they undergo any radiation exposure, then it also causes some damage to the fetus of the baby or fetus or embryo. So it causes lethal effects, malformation. Whoever the offspring or the newly formed baby, they will be malformed or head or some deviations in their head, hand or leg. So these kind of malformations can be seen. Growth disturbance with malformation. So these infants or the children will not grow properly. Premature stage is the most sensitive stage, which may cause lethal effect. So as the stage of embryo and fetus was premature stage, so when they get exposed to radiations in this stage, it may cause lethal effect. Sometimes it may cause death of the fetus inside the mother's womb. And the fetal risk depends on the gestation period of the pregnant woman. Period means usually the gestation period for human beings is 9 months, right? So depending on the period or depending on the month or the week at which the pregnant woman got exposed to radiations, depending on that, the fetal risk can be there. It's like if the gestation period is like above 5 months, then the risk of fetal risk is very much high. Mother exposure to diagnostic X-rays in the third trimester results in excessive childhood leukemia. A third trimester is so it is of 3 trimesters. That means 3 months. So in the third trimester, if the mother is exposed to X-rays, then it causes leukemia, that is blood cancer, in the upcoming childhood. And diagnostic X-ray can increase the risk of childhood cancer by 40%. So if the pregnant woman get exposed to X-rays, then the offspring or the childhood may have the risk of 40% risk of getting cancer, especially leukemia, that is blood cancer. And to avoid radiation-induced congenital anomalies, so an abortion may be advised only when does exceed 100 mgy is the units of measuring this radiations. So when the radiation dose was more than 100, it's better to suggest to go for abortion. Why? Because anyhow the baby, if mostly it undergoes miscarriage, or else if it is still surviving, there will be congenital anomalies will be there. So it's better to suggest an abortion in that case if the dose is more than 100. So this is effect of radiation on embryo and fetus. So this is the congenital anomalies. The head is different. Big size of the head you can see. So 2 heads. Caution, radiation hazard. So it's highly recommended that pregnant ladies should not go for X-rays scanning. So it causes lethal effects, malformation, growth disturbance with malformation, premature stage, it causes lethal effect, and it mainly depends on the gestation period of the pregnant woman. If it is in the third trimester, then it causes leukemia to the child, that is blood cancer. And if the mother is exposed to any X-rays, it has a risk of childhood cancer by 40%. And if the dose of exposure is 100 or exceeds more than 100, then it's better to suggest abortion in order to avoid this radiation induced congenital anomalies. Somatic effect means whatever the cells that got exposed, that will directly damage, or that cells will be killed, and it will induce some cancers. Genetic damage, so as there is genetic damage, the same that mutated cells will be transferred to the next generation or the offspring. Malignant transformation of cells means it causes cancer. It may either cause benign or malignant cancers. So what was the mechanism behind that? So mechanism of induction of damage, direct effect. So direct effect means So the radiations directly damage the DNA. So in both direct effect and indirect effect, the cells which were got affected is directly DNA gets affected. So this is seen example like alpha particles and neutrons. So the proportion of direct effect is 30%. So alpha particles and neutrons, they will directly damage this DNA due to direct deposition of energy in DNA. Then coming to mechanism of induction of damage, that is indirect effect. So in this, it doesn't directly affect the DNA. What does it will do is it will affect the radiations will enter, or it will affect the, or they'll send this energy, deposit this energy into the surrounding water. So whatever the H2O molecule is there, that will be affected with, this radiations. So it undergoes radiation hydrolysis. Radiation hydrolysis, during that process, free radicals will be released. So these free radicals will damage the DNA. So here DNA is damaged indirectly, whereas coming in the preceding one, directly the radiations will cause, they will deposit directly in the DNA and cause damage. When coming to indirect, it will deposit its energy in the water. So when then this water undergoes radiation hydrolysis. During that reaction, certain free radicals were released. These free radicals will damage the DNA. So this is an indirect phenomenon. Example include X-rays and gamma rays. So X-rays and gamma rays follows indirect effect, whereas alpha particles and neutrons follow direct effect. Okay, the proportion of indirect effect is 70%. So mostly it is caused by indirect effect only. Cellular level effects include gene mutations. So gene mutations, the changes takes place in the DNA sequencing of AT, adenosine, ATGC changes can be seen. Chromosome aberrations, that is abnormal structure of chromosomes. Inhibition of cell division, so cell division will be inhibited. Cell killing or cell death, that means cell stops dividing or functioning. So these are the cellular levels. So deterministic versus stochastic effects, that is differences between cell death and cell transformation. So cell death means, so here occurs due to cell killing, whereas it takes place due to cell modification. There is no threshold dose. Here the threshold dose will be there. Definite to occur in all individuals beyond threshold doses. So beyond the limited dose, so all the cells may undergo cell death. When coming to this, probabilistic in nature, that means it may occur by chance in some individuals. Severity of symptoms change increases with dose. So the severity of symptoms will be increased with the dose. When coming to this cell transformation, it is also probable. That means the severity or the risk of increase with dose, and it cannot be seen in all the individuals, like by chance it may get in some individuals. So that is cell transformation. So these are the different types of effects and the differences between cell death and cell transformation. And then ionizing radiations is widely employed for diagnostic purpose as well as for radiation treatment of malignant tumors. So treating these malignant tumors, so in that also they will be exposed to ionizing radiations, and also for diagnostic purpose also these ionizing radiations was commonly used. So those who are working in that radiology department, they are at more risk of getting these biological effects of radiation. And then, so generally this is radiation induced cellular death is mostly caused by radiolysis of water in the cell with generation of toxic hydroxyl radicals. And then during radiotherapy is done in malignant tumors, patients having malignant tumors. So during the treatment, what will happen? Not only the tumor cells, but also the cells which are surrounding these tumor cells, what are the normal cells which are surrounding the tumor cells, they may also get exposed to these radiations and they will be damaged. So that we call it as radiation induced tissue injury. So in this process, these radiations, where did they affect? They will affect the endothelial cells of arteries, venules, capillaries of the blood vessels. So because of that, there will be damage of these blood vessels causing the necrosis and ischemia. So this is how damaged or surrounding tissue takes place. So this whole process of damage to surrounding tissue is called as radiation induced tissue injury. Once again, I'll repeat. So during this radiotherapy, which is commonly done for malignant tumors, so during that treatment with radiation, so the tumor cells will be exposed to radiations. During that time, not only the tumor cells, the surrounding normal cells may also get affected. may also get exposed to these radiations. So when these normal cells gets exposed to these radiations, so these ionizing radiations, they cause damage to them by damaging the endothelial cells of capillaries, blood vessels, arterioles. So by cause of this, they undergo necrosis and ischemia. This is how this damage takes place. This process is called as radiation induced tissue injury. So if you see this, oxygen undergoes auto-oxidation by certain enzymatic reaction and it will be converted into superoxide. Again, it in the presence of superoxide dismutase converted into hydrogen peroxide, and this hydrogen peroxide in the presence of catalase and it undergoes Fenton reaction and forms hydroxyl radical. So hydroxyl radical, peroxide, superoxide radical. So all these will be formed due to radiolysis. So H2O, water, when it undergoes radiolysis, that means when it gets exposed to ionizing radiations, H2O will be converted into hydroxyl radical. H2O will be converted into hydroxyl radical. This hydroxyl radical will be converted into H2O2 and this will be converted into superoxide radical and then to oxygen. So again, if it undergoes auto, so this is a cyclic process. This is how radiolysis of water. Radiolysis means in the presence of radiations, there will be breakdown of water. So radiolysis of water, hydrolysis of water takes place in the presence of radiations. So during this process, certain free radicals like oxygen, hydroxyl radical, superoxide radical. So all these radicals were formed. As you know that radicals are highly reactive. So these radicals which were generated, they will react with normal cells and cause damage to the cells, causing the tissue injury. So this slide shows like different organs how they got affected with ionizing radiations. So if there is in the skin, it causes radiation dermatitis and cancer. Because of radiation, it causes inflammation of the derma or the skin, that we call it as radiation dermatitis, or it may also induce cancer. In lungs, it causes interstitial pulmonary fibrosis. In heart, myocardial fibrosis, constrictive pericarditis. In kidney, radiation nephritis. Gastrointestinal tract, strictures of small bowel and esophagus. Stricture means usually in bowel and esophagus, this is a lumen. Lumen means hollow space will be there. In that lumen, there will be formation of strictures kind of things can be seen. That means if this is the space, it will be narrowed at one part and again it is normal. Again narrowed. So that we call it a stricture. Narrowing of the lumen of any small bowel and esophagus can be seen. And gonads, testicular atrophy in males and destruction of ovaries in females. Hematopoietic tissues, pancytopenia, that means decrease in if it is pancytopenia means there will be decrease in the blood cell counts of more than two cells. Two different types of cells count will be decreased due to bone marrow depression. In eyes, it causes cataract. So these were the things that are caused due to ionizing radiations. In skin, radiation dermatitis and cancer. Lungs, interstitial pulmonary fibrosis. Heart, myocardial fibrosis, constrictive pericarditis. Kidney, radiation nephritis. GI tract, strictures of small bowel and esophagus. Gonads, testicular atrophy in male and destruction of ovaries in female. Hematopoietic tissue, pancytopenia because of bone marrow depression. Eyes, it causes cataract. So these were the effects of ionizing radiations on different organs. So not only ionizing radiations or UV radiations also cause certain damage. So it may cause UV radiations were seen in sunlight, that is solar light. So much exposure to sunlight causes these radiations effects, these biological effects. So it causes acute skin injury such as skin burns, sunburns. That means peeling of the outer layer of the skin can be seen, that is sunburns. Chronic conditions such as solar keratosis and early onset of cataracts also can be seen. And electromagnetic radiations which were formed by microwaves like ovens, radars, diathermy, and also ultrasound waves which were used for diagnostic purpose. They do not produce any ionization, so that does not cause any tissue injury. So ultrasonography is safer for pregnant ladies. right? So that is the reason you'll be doing this USG abdomen. Ultrasound scanning is very pretty much safer. Why? Because during that scanning, it does not generate or it does not produce any ionization. So which does not cause damage to the fetus or the embryo. So this was the picture showing sunburns. This is solar keratitis. This is cataracts. And then, so this was a dose range and immediate biological effect. If the dose is less than 0.1, there will be no detectable biological effect. If the dose is like 0.1 to 0.5, detectable increased chromosome aberrations, that means changes in the chromosomes. If the dose is 0.5 to 1.0, then chromosome aberration plus transient reduction in WBC count, that means leukopenia can be seen. If it is like 1, temporary sterility in males, that means they will be unable to participate in sexual activities. And 1.0 to 2.0, it causes symptoms like nausea, vomiting, diarrhea. NVD is nothing but nausea, vomiting, and diarrhea. Recovery probable. And if it is 2 to 3, threshold for induction of cancer, so that we call it as that at that age it may cause cancer, that means it will start or induce cancer. And radiation sickness in most exposed individuals, death of small percentage of individuals. Even at this threshold also, 10 to 30% of the individuals may undergo death. And 3 to 5, so this is the lethal dose. LD means lethal dose, 50 by 60 for human beings. So during this stage, it causes severe hemorrhage, means severe bleeding will be there. And if the dose is 5 to 10, severity of the above effects increases. Like no, like above all the above effects, severity will be increased. Like if in this dose range, almost 100% of the deaths will be there. If the dose is like 5 to 10, almost there is if they are exposed, there is no chances that they will be surviving. So there is 100% chance of death at these higher doses. So this is the dose range and these were the immediate biological effects. So this is all about the biological effects of radiation. And thank you all.